5 early signs of kidney damage you should not ignore. Your kidneys are unsung heroes, diligently working to filter waste and maintain your overall health. However, what happens when they begin to falter and you remain oblivious? Kidney damage often progresses silently without noticeable symptoms, leaving you unaware until it's too late. In fact, a staggering 90% of individuals with chronic kidney disease are unaware of their condition. But here's the encouraging news. Your body does send subtle warning signals. You just need to know how to interpret them. In this video, we'll explore 5 early signs of kidney damage that you must not overlook. Join us as we learn to recognize these red flags and safeguard your health before it's too late. 1. Foamy urine. Foamy urine is a condition characterized by the presence of small to medium-sized bubbles in urine. Normal foam is a thin, large layer that quickly dissipates, often caused by the force of the urine stream or common substances in the urine. Abnormal foam, however, is thick, persistent, and takes a long time to disappear. This could be a sign of proteinuria, which is the abnormal presence of protein in the urine. One of the key indicators of kidney disease is protein in the urine, also known as proteinuria. Healthy kidneys effectively filter waste products from the blood while retaining essential proteins, such as albumin. When the kidneys are damaged, the filtering membranes in the glomeruli become compromised, allowing protein to leak into the urine. This leakage can lead to a foamy appearance in the urine. Proteinuria is a very early sign of kidney disease and can be present even in the initial stages, stage 1, of chronic kidney disease, CKD. The mechanism behind this phenomenon is that the protein in the urine reduces the surface tension of the water, causing it to foam when it comes into contact with the surface of the toilet bowl. Foamy urine, a potential early sign of kidney damage. While not all cases of foamy urine are related to kidney disease, persistent foaminess should be taken seriously. Besides kidney disease, foamy urine can also be caused by dehydration. When your body is lacking fluids, urine becomes more concentrated, increasing its ability to foam. High protein intake. Consuming excessive protein, such as supplements, can temporarily increase the amount of protein in your urine. Urinary tract infections. Some infections can cause foam due to bacteria or inflammatory cells in the urine. Other conditions, for example, uncontrolled diabetes can damage the kidneys and lead to protein in the urine. When should you be concerned? If you notice persistent frothy urine that doesn't disappear after several days, especially if accompanied by other symptoms such as swelling, fatigue, or decreased urination, and you have a history of diabetes, high blood pressure, or kidney-related conditions, it's advisable to consult a healthcare professional. Detecting protein in urine accurately involves urine tests. An albumin to creatinine ratio (ACR) test measures the amount of protein in your urine. A urine dipstick test can quickly detect protein. Positive results may indicate kidney damage or other conditions. An ACR greater than 30 mg/g suggests an abnormality and requires further investigation. If you notice persistent foamy urine, it's important to stay hydrated to rule out dehydration. You should also consult a doctor for a urine test and kidney function assessment, eGFR, blood creatinine. Additionally, monitor your protein intake through your diet. Why is this sign important? Early detection. Foamy urine is one of the easily recognizable signs that doesn't require complex testing. Preventing serious damage, if detected early, lifestyle adjustments, blood pressure control, and blood sugar management can slow the progression of CKD. While foamy urine isn't always a cause for concern, persistent foaminess could be a warning sign of kidney damage. It's important to not ignore this symptom and seek medical advice to ensure your long-term health. 2. Nocturia, frequent nighttime urination. Nocturia is a condition characterized by frequent awakenings at night to urinate, typically more than once per night. This is not considered normal for healthy individuals, especially when it occurs regularly and disrupts sleep. Nocturia, or frequent urination at night, can be linked to kidney health. When kidney function declines, the body's ability to regulate water and salt balance is affected, leading to increased urine production at night. Additionally, a decrease in glomerular filtration rate, eGFR, a measure of kidney function, can contribute to nocturia. When kidneys are not filtering waste and water efficiently during the day, These substances may accumulate and be excreted more at night. A 2023 study found that a lower eGFR was associated with an increased number of nighttime urination episodes. While nocturia is a common symptom of kidney disease, it can also be caused by other factors. These include other medical conditions, diabetes. High blood sugar levels increase urine production, leading to frequent urination. Heart failure. Fluid buildup during the day is reabsorbed when lying down, resulting in increased nighttime urination. Urinary tract infections, UTIs. These infections irritate the bladder, causing frequent urination, including at night. Benign prostatic hyperplasia, BPH. An enlarged prostate gland in men can compress the urethra, leading to difficulty urinating and frequent urination, especially at night. Pregnancy. Increased pressure on the bladder causes women to urinate more frequently. Age-related changes. As we age, the production of antidiuretic hormone, ADH, which helps regulate urine production, decreases. This can lead to increased urine production at night. Additionally, the bladder capacity decreases in older adults, contributing to nocturia. Nocturia, or frequent nighttime urination, can be an early sign of chronic kidney disease, CKD. While other symptoms of CKD may not be apparent, nocturia often appears early on. This frequent nighttime urination can disrupt sleep, leading to fatigue, memory problems, and even affecting cardiovascular health. If you experience persistent nocturia, it could be a sign that your kidneys are not functioning properly, and it's important to consult a healthcare professional. Nocturia, or frequent nighttime urination, can sometimes be linked to kidney problems. To assess your kidney function, your doctor may order several tests. Estimated glomerular filtration rate, eGFR. This test measures how well your kidneys are filtering waste products from your blood. Blood creatinine test. This test measures the level of creatinine, a waste product, in your blood. It helps determine how well your kidneys are filtering waste. Urinalysis. This test examines your urine for the presence of protein, glucose, or signs of infection. In addition to these tests, your doctor may ask you to keep a diary of your nighttime urination frequency and volume. They may also ask you to monitor any accompanying symptoms, such as swelling, fatigue, or changes in urine output. Here are some ways to manage and prevent nocturia. Control underlying medical conditions. If you have high blood pressure or diabetes, it's important to manage these conditions effectively. Treat urinary tract infections or prostate problems. If these are contributing factors, addressing them can help reduce nocturia. Lifestyle changes. Limit fluid intake before bed, especially avoid caffeinated or alcoholic beverages. Reduce salt intake. A low-sodium diet can help reduce fluid retention and nocturia. Increase physical activity. Gentle exercise can reduce fluid buildup in the body during the day. Medication. Your doctor may prescribe diuretics or other medications to alleviate symptoms if necessary. When should you see a doctor? If you experience frequent and prolonged nighttime urination that disrupts your sleep, accompanied by other symptoms such as painful urination, urinary urgency, swelling, or fatigue, and have a history of kidney disease, high blood pressure, or diabetes, it is advisable to consult a doctor. Why is this symptom important? Nocturia is not only inconvenient, but also an early warning sign of many medical conditions, particularly CKD. Early detection and management of nocturia can help prevent more serious complications, including end-stage kidney disease. Nocturia, or frequent nighttime urination, is a common but often overlooked symptom. Especially when it's related to kidney health, prompt attention and intervention can help protect kidney function, improve sleep quality, and enhance overall well-being. If you find yourself waking up frequently to use the bathroom at night, don't hesitate to consult a healthcare professional for a checkup. 3. Blood in the urine. Blood in the urine, hematuria, is a condition where red blood cells are present in the urine. Hematuria is classified into two types: gross hematuria, where blood is visible to the naked eye, causing the urine to appear red, pink, brown, or tea-colored. Microscopic hematuria, where blood is not visible to the naked eye and can only be detected through a urine test. Kidney-related causes of blood in urine include damage to the glomerular filtration membrane. When the kidneys are damaged, the glomerular filtration membrane may not be able to retain red blood cells, leading to their leakage into the urine. Glomerulonephritis. This is a common cause of blood in urine and can be caused by infections, autoimmune diseases, or other conditions affecting the kidneys. Polycystic kidney disease. Large cysts can compress and damage the kidneys, resulting in blood in the urine. Kidney stones. Stones can damage the lining of the urinary tract, leading to bleeding. Kidney infection, pyelonephritis. Severe kidney infections can cause blood in the urine, along with pain in the flank area. Kidney or bladder cancer. Hematuria can be an early sign of malignant tumors in the kidneys or urinary tract. Early signs of kidney damage often include blood in the urine, particularly microscopic blood, which can be an early indicator of chronic kidney disease or serious kidney problems. The severity of kidney function decline is linked to this symptom. A 2018 study found that microscopic blood in the urine of patients with CKD is associated with a higher risk of disease progression and death, especially when the eGFR, glomerular filtration rate, decreases. Urinary tract disorders can sometimes lead to blood in the urine, hematuria. Here are some common causes. Urinary tract infections, UTIs. These infections can irritate and inflame the bladder or urethra, causing hematuria. Benign prostatic hyperplasia, BPH. In older men, an enlarged prostate gland can press on the urethra, leading to blood in the urine. Bladder or urethral stones. Stones can cause friction and damage to the lining of the urinary tract. Systemic causes. Bleeding disorders. Medical conditions or medications, such as blood thinners, can increase the risk of bleeding. Excessive exercise. High-intensity exercise can sometimes cause hematuria due to minor damage to the lining of the urinary tract. Urine tests can help assess your kidney health. A dipstick to detect a blood or protein in your urine. A microscopic examination can identify red blood cells under a microscope. Kidney function tests such as eGFR and blood creatinine evaluate your kidney's filtering capacity. An albumin-creatinine ratio ACR test can detect proteinuria, indicating potential glomerular damage. Imaging studies, such as ultrasound or CT scan, can check for kidney stones, cysts, or tumors. A cystoscopy can detect abnormalities in the bladder or urethra. If you notice blood in your urine, it's important to be aware of when to seek medical attention. You should consult a doctor if the urine is red, pink, or brown for several days, especially if accompanied by other symptoms such as pain in the flank, painful urination, swelling, or fatigue. Additionally, if you have a history of kidney disease, urinary tract infections, or other medical conditions, it's crucial to seek medical advice promptly. It's always best to err on the side of caution and consult a doctor for diagnosis and treatment. Prevention and treatment. Prevention. Staying hydrated by drinking plenty of water can help prevent kidney stones. Managing underlying conditions such as diabetes and high blood pressure is crucial. Avoiding overuse of medications that can harm the kidneys, such as NSAIDs, ibuprofen, is also important. Treatment. Treatment options depend on the underlying cause. Infection. Infections are treated with antibiotics. Kidney stones. Kidney stones may be treated with medications to dissolve them or surgical intervention. Glomerulonephritis. Treatment may involve immunosuppressant medications or symptom management. Cancer. Treatment options include surgery or specialized cancer therapies. 4. Decreased urination. Oliguria, or decreased urine output, occurs when the body produces less urine than normal. In adults, urine output less than 400 to 500 milliliters per day is considered oliguria. In more severe cases, urine output may be nearly absent, a condition known as anuria. This condition is often a sign of a problem with kidney function or blood flow to the kidneys. A reduced urine output, known as oliguria, can be a sign of kidney problems. Several conditions can lead to this, including acute kidney injury, AKI. This occurs when blood flow to the kidneys is significantly reduced or the kidneys are suddenly damaged. Oliguria is a primary symptom of AKI, especially when it develops in individuals with chronic kidney disease, CKD. Urinary tract obstruction. Conditions like kidney stones, enlarged prostate, or tumors pressing on the urethra can block urine flow, leading to reduced or absent urine output. Glomerulonephritis. Inflammation of the glomeruli, the filtering units of the kidneys, can damage the filtration membrane, reducing the ability to filter urine. Chronic kidney disease, CKD. As CKD progresses and kidney function declines, the ability to produce urine also decreases. The mechanism behind reduced urine output involves impaired kidney function. When the kidneys are not working properly, they cannot effectively filter blood and remove waste products. Decreased blood flow to the kidneys due to dehydration, blood loss, or heart failure can also lower the glomerular filtration rate, resulting in oliguria. Other causes of decreased urine output besides kidney disease include severe dehydration. This can occur due to diarrhea, vomiting, or excessive sweating without adequate fluid replacement. Shock. This can be caused by cardiogenic shock due to heart failure or heart attack. Septic shock due to severe infection, leading to reduced blood flow to the kidneys. Physical injury or surgery. Blood loss or post-surgical complications can reduce blood flow to the kidneys. If left untreated, oliguria can lead to several complications. Waste buildup. When urine output decreases, waste products like urea, creatinine, and other toxins cannot be excreted, leading to systemic poisoning. Electrolyte imbalances. Increased potassium levels in the blood, hyperkalemia, can cause dangerous heart rhythm disturbances. Increased acidity in the blood, metabolic acidosis, can lower blood pH, affecting organ function. Edema. Fluid retention due to inadequate elimination can cause swelling in the hands, feet, abdomen, or lungs, pulmonary edema. Acute or chronic kidney failure. If left untreated, oliguria can progress to irreversible kidney failure. Blood in the urine is not only a warning sign of kidney problems, but can also be associated with other serious medical conditions. If you notice any changes in the color of your urine, it's important to monitor it and seek medical attention promptly to protect your long-term health. Flank pain. Hip pain refers to discomfort or pain felt on either side of the lower body, in the area between the ribs and the hip. This region is close to the kidneys, which are often affected by conditions related to kidney function. The pain can occur on one or both sides, be a dull ache that persists, or a sharp, sudden pain, and radiate to the back or lower abdomen, depending on the cause. Kidney-related causes of pain can stem from various conditions. Kidney stones, for instance, can cause intense pain, often described as renal colic, when they move through the kidneys or ureters. This pain usually starts suddenly and may be accompanied by nausea, vomiting, or blood in the urine. Another cause is pyelonephritis, a kidney infection that can lead to pain in the flank along with symptoms like fever, chills, and painful urination. Glomerulonephritis, an inflammation and damage to the filtering units of the kidneys, can result in a dull ache in the flank, accompanied by swelling and blood or protein in the urine. Polycystic kidney disease, PKD, involves the growth of cysts in the kidneys, which can press on kidney tissue and cause chronic pain in the flank. While early stages of kidney cancer may be asymptomatic, as it progresses, it can cause flank pain, blood in the urine, and unexplained weight loss. Obstruction of the urinary tract, whether due to stones, tumors, or scar tissue, can also lead to flank pain. The pain mechanism involves the stimulation or blockage of the kidneys or ureters, triggering pain signals to the brain via nerves in the area. Inflammation or infection in the kidneys can cause swelling, putting pressure on surrounding tissues and resulting in pain. Besides kidney disease, other potential causes of hip pain include urinary tract infections, UTIs. If they spread to the ureters or bladder, they can cause pain in the hip area. Musculoskeletal disorders. Conditions such as muscle injuries, spinal arthritis, or herniated discs can cause pain that radiates to the hip. Gynecological conditions. In women, issues like ovarian cysts, endometriosis, or pelvic inflammatory disease can cause similar hip pain. Renal artery obstruction. Narrowing or blockage of the blood vessels supplying the kidneys can lead to pain and kidney damage. It's important to note that hip pain caused by kidney disease often comes with other symptoms, including fever, chills, kidney infection, blood in urine, foamy urine, or dark urine, swelling in the legs, ankles, or around the eyes, nausea, vomiting, or loss of appetite, painful urination, frequent urination, or feeling like you can't empty your bladder completely. Diagnosing hip pain related to kidney disease involves a comprehensive evaluation. We'll ask about the onset, severity, and any factors that worsen or improve your pain. Blood tests, including creatinine and eGFR, will assess your kidney function. CRP, or white blood cell count, will check for inflammation or infection. A urine test will detect blood, protein, or signs of infection. Imaging studies, such as a kidney ultrasound, can identify stones, cysts, or structural abnormalities in your kidneys. A CT scan or MRI may be used to pinpoint the location of any blockages or damage. If a urinary tract obstruction is suspected, a cystoscopy or ureteroscopy may be performed. Preventing hip pain caused by kidney disease. Staying hydrated by drinking enough water can help prevent kidney stones and improve kidney filtration. Managing underlying medical conditions by keeping blood pressure and blood sugar levels stable is crucial. Maintaining a healthy diet by limiting salt, foods high in oxalate, chocolate, tea, spinach, and animal protein is recommended. Regular health checkups, including kidney function and urine tests, are important, especially if you have risk factors. Hip pain is a significant symptom that can signal potential issues with your kidneys or urinary system. If you experience persistent hip pain or notice any other unusual symptoms, it's crucial to seek medical attention promptly to identify and address the underlying cause. Taking care of your kidney health early on is key to maintaining a high quality of life for years to come. Your kidneys are vital organs that don't always send out obvious warning signs. Instead, they may give subtle clues that indicate potential problems. Recognizing these 5 early signs could be crucial in detecting kidney damage early and preventing serious complications. If you've noticed any of these symptoms, it's important to seek medical attention promptly. Sharing this information with others who might benefit from it can help raise awareness about kidney health. Remember, prevention is always the best approach. We encourage you to like, subscribe, and turn on notifications for more health-related tips. Together, we can prioritize our well-being.